Let's begin with the latest in COVID and Omicron, and the news is not so good. A large chunk of Omicron cases in India are currently coming in that are contributing to what looks like a third wave of COVID-19 pandemic that has been reported in big cities. That's what the head of country's vaccine task force told NDTV, adding that the third wave of the pandemic is very much here. Large cities like Mumbai, Delhi, Kolkata have combined 75% share of the infections of the highly transmissible Omicron variant. India has so far reported 1,700 Omicron cases, with Maharashtra reporting most numbers and infections at 510. Remember, also Maharashtra testing a lot more than the rest of the country, and the vaccines to be used as booster doses. How soon will that come? Vishnu Som brings you all those details.
Big point over here, and this is somebody who actually tracks the rollout of vaccines in India. The key man as far as, for example, boosters are concerned, the key man as far as the vaccination of children are concerned. And here's what we know so far. The first key point is that 75% of cases in metros in India are now of Omicron, and India is in the middle of a third wave. No more are we not. India in a third wave, 75% of cases in the metros are Omicron. That's a key point. There has been a galloping increase in the number of cases in the last 4 or 5 days. In fact, there's been an incremental rise in cases, which is why we are now in a third wave. So India clearly in the midst of a third wave of COVID is what Dr. Arora told us. And he says, and I quote, "The whole wave seems to be driven by Omicron. It started in our major cities. It is likely to spread, as in the case of Delta, to other parts of the country." So the key question over here is on vaccines and boosters. Will these be for all adults? Will these be for those above 60 with comorbidities or healthcare and frontline workers? At the moment, they are still only talking about those above 60 with comorbidities and frontline workers. A decision on boosters will be based on science and available experience. And Corbevax and Covovax, remember, these are two of the new vaccines which have been cleared, emergency use authorization has been granted, are also being considered for use as children's vaccines. I think the key point over here is this. It's a question of time on when there is a broader introduction of boosters. It may not be in that announcement tomorrow or day after, but we will get an idea of whether some of the other new vaccines are being considered. So is India now in a third wave of COVID?
Yes, with the way during last 10 days, the dynamics of COVID infection we have seen during last 10 days or so, and the galloping increase in the number of cases which have occurred in last 4-5 days, India is clearly in the third wave of COVID, and the whole wave seems to be driven by a new variant, and today it is Omicron.
Would you say, sir, that Omicron is already the dominant strain in the country?
So I will give you some scientific information that when we look at whatever the variants have been, genome sequencing has been done, we got our first virus right in the first week of December. So last week, nationally, overall, 12% of the variants identified were Omicron, and the week gone by, the previous week, it has increased to 28%. So it is rapidly increasing as a proportion of all the COVID infections in the country. Now, having said that, I must also say something more important, and that is that around the major metro cities, Delhi, Mumbai, Kolkata, and particularly Delhi, it is over 75% of all the isolates now, the viruses are Omicron.